All right, we are live once again with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you again for taking the time to join us, Doctor.
My pleasure.
Wonderful. So my name is Dilshad Burman. I am a web writer with CityNews and 680 News, and I will be moderating this chat today. Once again, we have had a flood of questions for the doctor, and she's here to answer them live right now. So let's get right into it, Doctor. Are you ready?
Yeah, let's go.
Wonderful. Okay. So one of the most common questions we've been receiving over the past week is about masks. And because they are so strongly recommended, everybody is wondering, why aren't they mandatory?
So we are certainly looking into this to see how to make it mandatory. It's not as easy as just saying that it's mandatory, because if you make it mandatory, how are you going to enforce it, and what are the laws that can make something mandatory? What are the repercussions? Are you fined if you don't wear a mask? What we do know, though, is that certain businesses can have their own policies for customers and their staff to require masks. We've seen the TTC go ahead and make masks mandatory as well. And we have certainly given it a strong recommendation. We are continuing to look into this further. And I think the most important thing, though, is that we all do what we can. And so we wear masks when you can't maintain a physical distance. If that is outdoors, then you wear it outdoors. More importantly, though, that you wear it in indoor settings as well.
And of course, mandatory means law. So making something into a law isn't all that simple.
That's right. And it's which I mean, there are a lot of legislative tools that we have. And which ones do we use? There are public health tools, there's bylaws, there's the Emergency Act that's provincial. So we're looking into all the different types of legal tools there are to be able to make masks mandatory. Right now, it is a strong recommendation, and I think that that's really important. And, you know, just more to come.
Right. And then just to touch on the enforcement part of it, like you said, what could be some ways to enforce mandatory masks?
Most of the enforcement in places where they've had mandatory masks has actually been education. So even the TTC, while the TTC has made masks mandatory, if you're not wearing a mask, they will be educating you that you need to actually wear a mask, you need to have a mask. Part of making masks mandatory is you actually have to be able to provide masks. So you have to make sure that those people who might not be able to afford a mask, that they actually have access to a mask. So there's a lot of things that need to be put in place as well.
Right, absolutely. It's not, I think a lot of people feel like you can just declare it and then everybody will follow the rules, and it's not that simple.
Yeah, and in some ways we tried to do that by making it strongly recommended. And so that's the first step, yeah.
Okay, so we've got a few questions now about symptoms of COVID-19. I guess not so common symptoms. Priya asks, can an eye sty be a symptom of COVID-19?
An eye sty has not been noted to be a symptom. You can get conjunctivitis, which is redness in the eye. Pink eye is classically called. That can sometimes be associated with COVID-19, especially children can be more prone to getting that. Okay. And so if you do have a symptom of a pink eye or a red eye, then you should stay home and get tested. But a sty itself is not a symptom.
Okay. And then another one, Annie asks, is vertigo a symptom of COVID-19?
So the classic symptoms of COVID-19 are related to the respiratory tract: runny nose, trouble breathing, cough, sore throat. But there are some atypical symptoms. We call them atypical. And so if you're very old or if you're a child, you could have some of these atypical symptoms. And so it can include something like dizziness, having more frequent falls, especially in the elderly. So, you know, people who are in long-term care homes, we're noticing that could be a symptom of COVID, and they should get tested. Yeah.
Okay. Judy asks, of those who've had the virus, is there a statistic to show the percentage of people who were social distancing and wearing masks and who were not, or do we not know that detailed information?
We know that I think I shared last week, 65% of people who are getting COVID-19 have a close contact that they know had COVID-19, and that's where they're getting it from.
Right.
25% are getting it, we're calling it community transmission.
Yes.
We know that if you keep your distance, the reason why we say 6 feet distance is because the respiratory droplets, if we're just talking or speaking to one another, the farthest they go is 6 feet. And so that's why if you keep a 6 feet distance, you won't get it in that way. But we don't know, exactly how many people who have been doing all the right things got COVID. We think it's actually very small because in most people who get it, you can actually pinpoint where they got it from.
Okay, so on that note, actually, we've got a question about contact tracing by Ian. He asked, what is the city doing in terms of contact tracing and tracking infection chains?
So we've been doing contact tracing since we had the very first case in January. It is part of what we call our bread and butter of public health. We started out with about 50 people in February. We now have over 700 people in the city doing contact tracing. And so each time we get lab confirmation of someone who has the infection and they live in Toronto, they will get a call from Toronto Public Health within 24 hours.
Okay.
And what contact tracing does is we try and figure out where did you get the infection. So we go back 14 days. And we also try and figure out who could you have spread it to. So we go back 48 hours from when your symptoms started until you go into self-isolation. And that's pretty much what we do for contact tracing.
Okay. And then a related question to that, Ontario is supposed to be trying out a new contact tracing app, I believe. Is Toronto part of those trials? And regarding the app itself, do we know how accurate that would be?
So the app is a good idea for everyone to have on their phone. The app is one way for you to be able to remember, okay, if you got COVID today, going back 14 days, where were you? The app will help you keep track of that. If other people, if the app requires that a lot of people have it in order for it to be the most effective.
Yes.
And so if someone else has the app and they're identified and they put it in their app and you have the app as well and you got COVID and it was within 14 days and you were close to them, the app might be able to say that might have been a link. But the key thing that the app will help with public health is to be able to track where you've been so that you can remember it, because it's often quite difficult to remember. What did you do 8 or 9 days ago?
Yes, absolutely, absolutely. This one comes from in our newsroom. Our producer Mike asks, do you have any updates on the coronavirus vaccine? And how soon do you think it will be before the first one is available? And also, where does Canada stand in terms of actually getting the vaccine?
There's the vaccine. There's a number of steps that a vaccine has to go through in order to be licensed.
Mm-hmm.
And so there is one vaccine that has been given Health Canada approval to begin testing in Canada, which is a good sign.
Okay.
Usually, I don't have my crystal ball, but you can expect that it's at least going to take more than 6 months, probably a year, maybe a year and a half. Once we have a vaccine, we have to first see, does it work and is it safe? And it's only when those things are, that we know those, that we can actually get the vaccine. And then we have to think about how can we manufacture the vaccine and who should we give the vaccine to and how will we give it? So there are a lot of steps that need to come in place. That being said, we've already started talking at Toronto Public Health. We call them mass immunization clinics. How would we do those? And to at least start thinking about it, because that is our hope, that we have a vaccine that will certainly help us get out of this COVID-19 situation in a much better place.
Right. And you mentioned, who gets the vaccine, who is priority. Is there sort of talk about, who's going to be prioritized in terms of getting the vaccine, or is it just, carte blanche, whoever wants it gets it?
Well, these are the discussions that have to happen. And the National Advisory Committee on Immunization usually puts out their recommendations for who they recommend should get the vaccine first.
Okay.
And then each province has to decide what they do. So absolutely, you won't have enough vaccine, on the day that the vaccine is licensed and available, you won't have 30 million doses to give it to everyone all at once. And so you'll have to make decisions on who gets the first set for sure.
Right. Okay. Okay, a couple of questions about things are opening up, so everybody's moving outside. John asks, he's immunocompromised and he feels anxious about the lifting restrictions and he's more worried than before. Is he justified in his worry, and should he be doing something different from people who are not immunocompromised?
So when you have a weakened immune system, the risk, you're just as likely to get COVID as anyone else. Like, it spreads in the same way.
Mm-hmm.
But if you got COVID, you could have a more severe infection. And that's why we think that people who are at higher risk for getting a severe infection should take extra precautions. And so just because outdoor patios are open now doesn't mean that you should go. I mean, definitely there are some people that need to take extra precautions. If you have expanded your social circle to 10 people, be mindful of who those people are and make sure that you know that they're practicing the same stringent precautions as you are, because you don't want to be put at higher risk than you need to.
Absolutely. So this is an interesting one. Currently, people arriving from overseas must quarantine for 14 days. But can they simply go around that by taking a test? And if they're found negative, would they still need to follow those 14-day quarantine orders?
So you still need to stay in quarantine for 14 days if you travel. Unless you have one of the exemptions, you still need to be in quarantine for 14 days. If you arrive in Canada, say today, and you got a test 2 days from now and the test was negative, all it means is that on that day, you don't have COVID. But there's still another 12 more days, and you could develop symptoms or could get COVID and could put others at risk. And that's why the quarantine is for the full 14 days, regardless of testing.
Okay. And really, if you're in quarantine, you shouldn't really be stepping out to get tested in the first place.
Yeah, except though that if you have symptoms
Right.
and you need to go and get tested, you could, but you'd have to use the right precautions in order to go and get the test.
Right, absolutely. So more about travel then. Jim asks, can Ontarians travel across to Quebec and back without restrictions? And then Jag has a similar question. He says he wants to visit his elderly parents in Quebec, and he doesn't have the virus. Should he get tested before he goes? Should he be in quarantine when he goes to see them?
Right now, we don't have Ontario and Quebec don't have restrictions on within Canada travel. I think there are some provinces that do, so that's something that you'd have to look into. Yes. You want to be careful about going to a place that has a COVID outbreak, and make sure that if you go to those places that you take precautions. We certainly do have recommendations, here in Toronto, in Ontario. If you're visiting someone in a long-term care home, well, now you need to be tested before you visit them. And so if you were going to visit your elderly parents who are in a long-term care home in Quebec, that could be a consideration as well.
Right, absolutely. I think the precautions for visiting elderly relatives is still fairly high. Like, you still have to do all of those steps. It's not just as simple as going and visiting.
That's right. And you still want to make sure that you're not bringing anything to them, because, well, if you get it, you may be able to manage it. They might have a more severe illness.
Yes, absolutely. This one we've got again from two people, Stewie and Anonymous. Can you get COVID over and over? Like, if you fully recovered from COVID, can you catch it again and then transmit it in some way?
The short answer is probably not. So if you get COVID, we know that you can actually shed the virus for even up to 90 days. And so if you, you get tested, you have COVID, after 14 days, you're considered not infectious. And so we actually don't recommend that you get a clearance test. You don't need to have a test or a letter to go back to work. After 14 days from when your symptoms started or from when you got your test done, you are considered cleared.
Okay.
But there are some people who go on and get further tests done, and sometimes they're negative and sometimes they're positive. Unless you were really sick in hospital, in an ICU where you had a very weak immune system, those positive tests that you get are probably just old virus that your body is still shedding, but we don't think that it means that you're contagious. And so anyone who's had COVID and been tested, after 14 days, you're cleared, and after that, don't get another COVID test for at least another 90 days. That's what my recommendation would be.
Okay, that's very interesting. And then you're saying that you probably won't catch it again?
So if you, though, in those 90 days got really sick, had a fever, it felt like these are symptoms consistent of COVID, okay, well, then you can go and get tested and see what the test shows. But if in those 90 days you had no symptoms and you were just fine, it would be unlikely for you to get please don't get tested. If you get sick again, then you can consider getting tested. But even in that situation, there are lots of other viruses that can give you those kind of symptoms. And so the reinfection, we're not sure of in the short term. We don't know long term, like 6 months, 1 year later, we don't know if the immunity is going to last.
Right.
But at least in the short term, that much seems to be clearer.
Okay. So within like a 90-day period, at least for the most part, you're not going to necessarily recatch it. Like you said, long-term immunity is still being judged.
Yeah.
Okay. Here's another one. Nina asks, how does COVID affect mild heart conditions like tachycardia?
So if you have a chronic condition, some people get a more severe illness. So we know things like high blood pressure is more associated. Some tachycardias actually don't put you at higher risk. It's hard to know. But I think if you have a chronic condition, you can expect that if you got COVID, you might get more sick with it.
Okay. And then speaking of sickness, then this is anonymous. What percentage of younger individuals, say below 60, are being infected? And then what is the recovery rate?
So we have people in all age groups that are getting COVID. The younger ages actually make up the majority of the cases, but they tend to recover more. Most of the deaths and the severe infections are in those who are 60 and older. And so the recovery rate, if you're younger, is better, but you can't predict it. So you actually don't really know if you're younger that you're actually going to get, if you got COVID, that you would actually recover. Some people, it's hard to predict why some young people are getting very sick and some are even dying.
Right.
It's not predictable.
Right. I mean, the only thing you can do is take all the precautions you can possibly take. I don't think anybody wants to take their chances with getting COVID.
That's it. And I think some people actually feel frustrated with the precautions and say, just give me COVID. But again, if you get it, you don't know how sick you're going to get. And you also don't know that if you get it, that's going to keep you protected for life either. And so it's quite a gamble.
Yeah. And it's not like chicken pox. It's not like if one kid gets it, you just put a bunch of kids together, everybody's immune. It's not like that.
That's right. Yeah.
Right. Okay. So Janet asks, I'd like to understand the importance of getting tested when one doesn't have any symptoms. How will this help fight the virus? And of course, is it not possible to get the virus after you get tested?
So yes to all of those. So I think the most important, the people who really need to get tested are those who have symptoms, even one symptom. Now, in some settings, we are recommending that you go and get tested if you have no symptoms. I just talked about one. If you want to go visit, your loved one in a long-term care home. Yes. Getting tested when you don't have symptoms can sometimes be problematic because if you get a positive test, you're not quite sure. You have to go back and see, well, when could you have gotten the infection? Now you're indoors for 14 days under self-isolation, and there's a question of, could it be a false positive? Could it be that you got the infection 80 days ago and now you're still shedding the virus and so you're not actually infectious anymore? So that can be some of the tricky parts about getting tested if you have no symptoms. But in general, it's really it's good to have what we have in Ontario that we're starting is like a plan for surveillance, is to kind of have some routine testing of people without symptoms to see how much asymptomatic disease do we have in Ontario, because that will make sense for how much virus might be spreading without us knowing about it.
Right. Okay. So that's how that kind of, it's basically almost data collection. That's how we're finding out how much of the virus is present in the province and where we're standing basically.
That's right. That's right. Because you can see with the numbers, we've tried to get our numbers down quite low. And it's actually exciting to say that Toronto's moving into phase 2, that we had almost 14,000 cases and now we're down to, 30 something a day, which is really great. Yes. But if there are cases that we don't know about, those cases can spread and can cause outbreaks or more disease. And so that's why we want to keep a close handle on all the infections.
Absolutely. A little more about contact tracing, and we might have covered this already, but Joan wants to clarify what exactly is contact tracing. She says, someone at my work lives with someone who was just tested positive for the virus. The health department says that person needs to self-isolate, but she and everybody at work can continue as normal. So how does that work in terms of contact?
Okay, good question. So with contact tracing, you want to find out where did the person get the infection and who could they have spread it to. And when you're trying to figure out who they could have spread it to, those are the contacts. But we divide contacts into high, medium, and low risk. Okay. And so if you pass someone in the grocery store, that would be considered a low-risk contact. We wouldn't necessarily get in touch with you because we know that COVID is spreading. You need to take precautions. Similarly, a medium-risk contact is someone in a workplace. You work with them. They work down the hall, but you have not had 6 feet contact with them for more than 15 minutes. And so the fact that they were in your work environment means you could have been exposed, but the risk is not high. And so we ask you then what we call self-monitor. Keep a close eye on your symptoms. If you get symptoms, stay home and get tested. But again, your risk is not the high risk. But if in that work environment, you had someone who you worked with very closely, there were times when you didn't keep that 6 feet distance, that would be considered a high-risk contact. People you live with are in that situation as well, and they are asked to self-isolate. And so we call it a risk assessment. It's a risk-based approach based on how much contact you've had with the person who was contagious.
Okay. And so if you have had contact with somebody that was contagious, the people in your household would also then be considered high-risk contact?
No. So if you had contact with someone at work, you're considered high risk and you need to isolate. The people in your household, they never had contact with that person. They only have contact with you. And so they are a contact of a contact. And so your household members need to stay away from you. Try and keep as much distance as you can, as much as you can in a household. If you develop COVID, they become high risk contacts at that point.
Okay, that makes sense. Okay. A little more about virus spread. Jay asks, can the coronavirus be transmitted in a chlorinated pool?
No, there's no evidence that it spreads in water, especially chlorinated water.
Okay. The only thing I think you've mentioned before with pools is stay 6 feet apart from each other.
It's the people that you're in touch with, but it's not that we're worried that the people, if they have COVID on their skin, that it's getting into the water, or even if they cough into the water, we're not worried that it spreads through the water. It's if you're close with people while you're, say, playing in the pool or in the change room, that's how it could spread. Exactly.
Right. And then Pamela asks, will splash pads and wading pools be open soon to beat the heat with babies and toddlers?
Yes, I'm very happy to say yes. We've just actually finalized our guidelines for those. They're going to be posted. They've actually just been posted. We've been in touch in Toronto with Parks, Forestry and Recreation to get the splash pads and wading pools opened. Some of the things will still be closed, like if there's a climbing wall or a slide, those still are not allowed, but the actual sprinkler type splash pads will be opened. We are asking, though, that you have to take precautions, though. So as much as you can, parents, you got to keep track of your children and keep them 6 feet apart from those who are not in their household. You know, if you're touching the buttons, use your elbow. Don't go if you're sick, things like that.
Yeah, the precautions that we're asking everybody to take, basically. You just have to keep mindful of that everywhere.
That's right. And I think another big one is if it's busy, come back later. You know, you may have packed everyone up and gotten there, but if it's very busy, please don't take the risk. Find another splash pad, find something else to do, and make plans for another day when it's less busy.
Right. This is an interesting one. James asks, hospital workers, doctors, nurses, and others dressed in full PPE are routinely seen on the sidewalks and coffee shops and restaurants outside of Mount Sinai, Princess Margaret, various other hospitals on Hospital Row. And now presumably they have seen COVID patients and they might have the virus on them. So why isn't hospital administration, requiring that they remove the PPE before they step out and touch all these things? And is there any sort of, rules for that?
It's a good question, actually, and I can see how, as a member of the public, you would be alarmed by that. Oh, the one thing I can tell you is that if you're a healthcare provider and you work you're taking care of a patient on either COVID ward or someone who has COVID, there are strict protocols in place to make sure that after you see that patient that your PPE is discarded, or, does not leave that ward. So those people that you see, you actually don't really know where they work. They could work in the kitchen. Like some people are wearing gowns when they might not need to. They're just wearing it to protect their clothing as well. So I mean, I can't speak for everyone. I think it's a good point that I think PPE should stay. It's to protect you when you're working in the hospital, but that those who actually are working on COVID floors or seeing COVID patients, there are rules on being able to discard those that equipment.
Right. Okay, more about traveling here. Julie asks, can a visitor from Alberta get a COVID test in Ontario?
Yeah,
okay.
Actually, anyone, even visitors from anywhere, anyone who comes to Ontario, you don't need a no-hit card. If you think you have symptoms and need to get tested, you can go to an assessment center and get tested.
And that's still covered by whichever provincial health plan you're on?
Sometimes it might be billed from the other health plan, but if you come from abroad and need to get the test, that will not be a barrier for you to get the test.
Okay. Amy asks, is it possible that if you got the flu shot, you could test positive for COVID-19 since the flu shot has a bunch of different strains? And if so, then testing positive wouldn't necessarily mean that you have COVID.
Yeah, so another thoughtful question. The flu shot has three strains of the flu virus. Some of them actually have 4 strains, but it's the flu, it's actually not even the whole virus. It's pieces of the flu virus and different strains of the flu virus. There's no coronavirus in the flu shot. And so the flu vaccine has not been shown to make people test positive for COVID.
Okay. And this is another one. We've had this question before, but good to reiterate. Is wearing a face shield as effective as wearing a cotton face mask? Cami says that her work in the retail sector requires her to greet customers and she speaks to them while she's wearing the mask and it becomes very hot and sweaty. And so would a face shield in such an instance be a better form of PPE?
No, not for so the mask is to cover the nose and the mouth. The mask really is to keep your respiratory germs to yourself. Mm-hmm. If you're talking a lot, actually it makes sense to wear a mask because when you talk, that's how you can share your droplets or your germs. So if you're wearing a cloth mask in those settings, yes, you have to change it when it gets wet. You could consider finding a non-medical mask other than a cloth one that might be better for you. The face shield is intended to protect the eyes, and that's really what it offers protection for. It doesn't offer protection the way a mask does, and so a mask would still be required.
Okay. We get that question often, and it's interesting because like you say, the face shield, it covers your face, but really it's just for the eyes.
Yeah, and I think it's a really good question because some of the face shields go down low, but they really have not been studied to say if you cough wearing a face shield or wearing a mask. Right now, the mask is going to give you keep your germs inside more than a face shield. A face shield, if you cough, it's going to be contaminated, and if someone else coughs near you, you can't guarantee that it's not going to get to you. So that's why the face shield, and you know what, there may be more evidence on face shields coming out. I know that there are some people who think that the face shield will offer as good protection and maybe easier to use, but right now we're not there yet.
Okay. And then a related question about masks. If you wear a mask and then don't wash it right after wearing it, and then you wear it again, is it possible for you to, does the virus stay on that mask? Is it possible for you to catch it that way?
So you want to make sure when you wear a mask that you know what's the inside of the mask and what's the outside of the mask. And so you keep the outside out and the inside in. Mm-hmm. So if you're reusing a mask, we say that you can put it in something like a paper bag and hang on to it and then reuse it. but be sure that the part that goes to your mouth is up to you so that you put that same part on you. Depending upon the type of material of the mask, the virus could last on the surface for a different amount of time, perhaps up to 72 hours on certain types of materials.
Right. And then the question that we've been getting a lot, but we haven't asked for a while, where are we on antibody testing?
We still don't have a routine antibody test available in Ontario. There's still not any day now. They're still doing testing and to figure out who it should be provided to and what you do with the results. So we're still relying on that nasal swab for testing in Ontario.
Okay. There is an antibody test that's been approved in Canada, though, correct?
That's right. Health Canada has approved a test, and so they are doing some testing in Ontario to see if we could use it. But again, some of the tests, you have to be clear on what the results mean. Some of the results have not been reliable, and that's problematic.
Right, and you don't want to rush anything. You can't just start randomly doing stuff without actually having a proper test that gives you the results that are bankable, basically.
That's right. Yeah.
Okay, and then maybe I think we have time for one more. In Alberta, it was reported that the death rate for those under 65 is 0.0006. Do we have those statistics for Ontario?
There's really good information on the Ministry of Health website for all of Ontario. We see about 1% of our total cases actually end up in death overall. But we have looked at the rates of death in the different age groups, and it is the older you are, the higher the death rate for sure. So some of those numbers, you could go to the Toronto Public Health website, toronto.ca/COVID, for Toronto-specific data, and the Ministry of Health has Ontario-specific data as well.
Okay, wonderful. And then I think we'll wrap up with this last one. Is it safe to drive rideshare cars with someone sitting behind you? So if you're the driver, an Uber driver or a Lyft driver, is it safe for you?
So you have to take precautions, and so we definitely would recommend that if you're doing this as a full-time job, that you consider a plexiglass barrier between the driver's seat and the back seat. For those who are sitting in the back, you should ask your clients to wear a mask. You wear a mask as well. If they have symptoms, we recommend that they actually don't take a rideshare program. They try and get there on their own. If you roll down the windows, that will also help to reduce the risk as well. And then cleaning the insides, doing some cleaning and disinfection will also be really important.
Okay, so that's all we have time for today. Okay. But thank you so much again, Doctor, for joining us. And we look forward to many more questions next week as well. Thank you for taking the time.
Okay, my pleasure. Bye. Have a good day.
All right. Bye-bye. Have a nice day.